I'm Wayne Teo. I'm a co-founder of Healthy Mind Menu and its chairperson. The conversation started with Stephen Clark in his restaurant at Clark's of Northbridge. After my wife and I had dinner there one night, we were facing with the reality and you could say grieving the loss of another young chef. That really put a bit more urgency to it.
My name is Paisley Madison. I'm the coordinator at Healthy Mind Menu. It's really important to me because in 2018 I lost my favourite chef and eldest brother, and he passed by suicide. So when I see the statistics that surround a lot of the work that we're doing, I feel a real personal flame to make change and really understand what's happening in the hospitality industry.
So after working out the key ingredients, as we now quite often use at Healthy Mind Menu, what's going to make a mental health charity for hospitality work? And then came the discussion about using mental health to get the best version of yourself. Sometimes all you have to do is create that space for that person to talk, time out, be there for them, listen. The year was looking promising. Unfortunately, COVID hit. As things started to bed down, Healthy Mind Menu called an emergency committee meeting to address what we could do. We knew for a fact that we needed to be doing something because the industry would need us more than ever. We realized, hang on, here we are talking online. Let's try and put in our mental health pyramid into an online course. In an effort to always redefine, had a real look at how we connect with the industry that was changing so much. We knew that the industry was time poor, so we decided, okay, instead of going to venues, we'll try and schedule online support sessions. Although the response was good, the registration sometimes outweighed the ones that actually attended. So we decided, hey, we'll record that and then have it available for people to watch with graphics later. But then once again, redefining all that, highly commend them to Angela and Paisley, who worked with her, say, hey, let's push this to a podcast.
Welcome to Back of House, Front of Mind, presented by Healthy Mind Menu. I am Angela.
And I'm Paisley, and we will be your hosts. Healthy Mind Menu is an industry-led initiative that recognises a key ingredient in hospitality is its people. Our mission is to improve the lives and normalise conversations around mental health for those working in the hospitality industry.
Each episode will be diving into different topics related to mental health and chatting with experts and friends in the industry. So join us, sit back, and let's make sure mental health in the hospitality industry is always on the menu.
It is about standing up for yourself, about the pay that you deserve, about the building the team. We have to look after ourselves.
Want to come back in, and we've got to show them, that okay, we'll look out for you guys. We want you here. We'll look after you.
What will enrich you? Put your hand up and ask if you need help. Put your hand up and ask if you need training.
Well, some of the questions that we're asking, and this also comes into the podcast that we put out, Back of House, Front of Mind, it's really about having these conversations around mental health in hospitality, what it currently looks like, but also asking the question about what do we think healthy hospitality is. One of the challenges that we found for Healthy Mind Menu is that there was not a lot of information out there on how we could support the hospitality industry. We wanted to make sure we had it right and we had a really good understanding. So this year we partnered with ECU, the Workplace and Wellbeing Centre, to conduct some research to truly understand what is at the heart of these challenges for hospitality, what makes hospitality great, and also what can we do to really support both the worker at an individual level, but also the workplace and venues as well. The research has 3 phases. Phase 1 is this exploration phase. So we're really having a deep dive into research across the world, but also here in Australia. It was interesting because a lot of the research so far that exists is about worker productivity, which isn't always about worker well-being. So we brought a lot of employees and employers from around WA in nice and close to do some research around focus groups, and also a wellbeing survey that goes out to staff. We're going to collect all this information, and that will form part of a toolkit that we develop, which will be like a best practice guide that we can share with the hospitality industry in WA, but also Australia-wide.